How is the current turmoil in the federal government going to affect the quality payment program?
Oh, great question, David. I wish I knew for sure. We are certainly living in uncertain times when it comes to federal programs and enforcement of federal rules. Now, whether you are a MIPS participant or a participant in one of the alternative payment models of the Center for Medicare and Medicaid Innovation, that is CMMI, there have already been changes and there may yet be more. It's a volatile situation. Things can change quickly. This is what is happening and how I see things today, but it could be different tomorrow. Medicare continues to function. It's paying for care as it normally does. It's running the merit-based incentive payment system as it has in recent years, and it's running the Medicare Shared Savings Program. All programs are fully operational. We're well into the 2025 performance year already, past the first quarter. Now, Medicare has canceled a couple mandatory monthly meetings they've held for the last 18 years to manage their qualified registries. So for the first time, they called those off. CMMI has brought four programs to early closure. The Maryland total cost of care model is closing at the end of 2025, as is the primary care first model, the end-stage renal disease treatment choices model, and the making care primary model. Now, it's hard to be sure what's going to be left and what's going to be required of us when 2025 comes to a close and we enter the submission season. That is the first quarter of 2026 for our 2025 data. Now, I'm not expecting to see any of the core programs change. Medicare is the world's biggest healthcare insurance program, and the people in the United States depend on it. Damage to the program, I think, would amount to political suicide. Now, I include in that assessment that Medicare Part B, the physician payment program, Medicare Part A, the hospital payment program, Medicare Part D, the drug payment program, Medicare Advantage, and the merit-based incentive payment program and the Medicare Shared Savings Program will all continue to function. You should plan to continue business as usual, provide care, generate bills, participate in quality assessment, quality reporting, advance the use of your certified electronic health record technology. Don't expect relaxation of the requirements. I think we should expect a general slowdown of service and of programmatic evolution. For MSSP users, that's a Medicare Shared Savings Program, the web interface is gone after this 2024 data submission window is over. And I don't expect Medicare to have the resources or the will to revive it. So you will be going to eCQMs, Medicare CQMs, or MIPS CQMs for the next couple of years for your submissions. I'm expecting less activity than usual in the proposed and final rules for the physician fee schedule. I don't think there will be as many changes. I don't think there's going to be as many people working on the proposed and the final rules and able to curate those changes. I'm expecting slowdowns for the programmatic evolutions they've already posed, like moving to MIPS value pathways, or generating and opening new CMMI APM models. I'm expecting delays in service and attention. So the QPP help desk may not be as responsive. Individual attention to extreme and unusual circumstances applications might be slower. Now, it could be that they will refuse more, or it could be they'll rubber stamp more to keep their workload down. It's probably not a good time to start participating in a new program, that is building a new ACO, participating in a new CMMI program. Day to day, the safest approach will be to expect no change to your requirements. Even if anything does change, we've seen enough volatility that an announced change one day might be canceled the next. So my advice, continue business as usual. Provide the great care you always provide to your patients. Continue to collect and save your data. Continue to improve on your EHR functionality. Plan to continue compliance with submissions. Don't trust changes until it's too late for Medicare or their federal overseers to reverse them. And if you're in the MSSP, the Medicare Shared Savings Program, plan to switch to eCQMs, MIPS CQMs, or Medicare CQMs. You will not have the web interface to fall back on. Good luck managing all these changes with the rest of us.